This short presentation has been prepared to provide additional specific information for newborn babies who are being considered for enrolment in the recovery trial. This information should be used alongside the other training materials provided by Recovery. Transmission of COVID-19 from a mother to her unborn baby is very unlikely, and there is a low risk of babies being infected at birth, even if born to a confirmed COVID-19 positive mother. Infection in the neonatal period, that is less than 28 days old, has been described, but the majority of babies who develop COVID-19 present with mild symptoms or are asymptomatic. Babies who are symptomatic can present days to weeks after birth. In the neonatal period, clinicians may choose to treat infants of any gestation on the basis of clinical signs alone if there is a high index of suspicion for COVID-19 infection. This may especially be the case where the clinical deterioration is not explained by existing neonatal conditions. Where the cause of the clinical deterioration or collapse is unknown, the possibility of COVID-19 infection should be considered. For the few babies who do develop suspected or confirmed infection, a robust evidence base is essential to guide the use of effective treatments and to avoid potential harm from severe or life-threatening disease or from the treatments themselves. There are currently no proven treatments for COVID-19 for either adults or children. The Royal College of Paediatrics and Child Health recommend that treatments for COVID-19 should only be used in the context of a treatment trial. These guidelines are constantly being updated, so please make sure you're aware of the latest version. The links are provided here. It is anticipated that any child with suspicion of COVID-19 being considered for treatment, that is over and above supportive care, should be enrolled in the recovery trial. Criteria for starting babies less than or equal to 28 days old on study treatments may include the following: increase in respiratory support to maintain oxygen saturations within accepted limits, that is new or above a baby's previous baseline, signs of sepsis with shock, encephalopathy or multi-organ failure. Patient information leaflets and consent. Parents of babies, infants and children less than 10 years of age should be provided with a younger child information leaflet. The parent or the guardian should sign the consent form. Witness consent may be obtained over the telephone or web video link if hospital visiting rules or parental infection mean that a parent or guardian cannot physically be present to sign the consent form.